Hello and welcome to this recorded presentation for the employees of Within Design for the benefit program beginning July 1st, 2023. My name is Bill Hammond. I'm proud to be your insurance expert. You're welcome to reach out to me now and throughout this whole open enrollment process if you have questions about the plans, the rates, what's best for you, what some of the terminology means. If you just need a few minutes to kind of go over what might be best for you and your family, or if you have somebody else that helps you make these decisions that you would like to include in this conversation, reach out to me. The best way to do it is send me an email. Let's set up a time and then we'll have that appointment. You're also welcome to call me at any time. Available to you also is Rhiannon and Anna. They are the account manager and benefit administrator assigned to your account. They will be able to help you throughout the year on missing ID cards, finding doctors, claims issues, understanding benefits, whatever it may be. All three of us are available to you now, tomorrow, the next day, all through the year. And you're welcome to reach out to us for anything related to any of the plans we're offering, any questions you have. We're a great place to start and happy to help in any way. Talk about our agenda here, quick timeline of open enrollment. We're enrolling in new medical plans. We'll talk about that. Dental and vision is staying the same. We're adding a whole bunch of new benefits, including life insurance and critical illness and hospital indemnity coverage, EAP, lots of really cool additional new benefits for you. We'll talk a little bit about how do I enroll. And if you have questions, you need answers, we're here for you. So let's talk about open enrollment. It goes from June 8th to June 16th. That's a Friday. This is the time of year where those of you that are already enrolled can add or waive, add dependents, remove dependents, move from one plan to the next. For those of you that are not enrolled, this is your time to enroll in benefits. Any changes that you make will go into effect July 1st. You must complete enrollment no later than Friday, June 16th. And you'll complete all those applications online at our EASE benefit enrollment portal, which we'll talk a little bit about. So we got 10 plans, a lot of plans. We're going with Anthem Blue Cross. This is a new provider. So there's 6 HMO plans and 4 PPO plans. Real quick, you'll notice that there's 2 platinum, 2 gold, 2 silver HMO plans. Each of them is either a select HMO or priority select HMO. All right, down here at the bottom, select network basically means sharp doctors. So if you want to see sharp doctors or UCSD doctors, you're going to want to go with one of these select network plans. Priority select means Scripps doctors. So if you need to see Scripps providers, this is where you're going to want to go. So we'll talk a little bit more about this. And then PPO, of course, this is for those of you that want lots of choice, that don't want to be stuck inside one medical group, that want to be able to have so mobility, be nimble with the providers you see. PPO plans are a great option. You'll see in a couple of slides that the Gold Select and the Gold Priority Select, all these HMO plans, even though there are 2 of them, the Silver Select HMO is exactly the same as the Silver Priority Select. The only difference is the network of providers. Speaking of network, this is not all of the providers and the medical groups in the Select and Priority Select networks, but this does give you a really good look at who is in them. So if you like Sharp Steely, Sharp Community, UC San Diego, Mercy's, Mercy Physicians Medical Group, actually those are with both of the medical groups. But again, Select is going to be mostly Sharp kind of doctors, and then Priority Select is mostly Scripps. Not a complete list again, but this is going to be generally the biggest providers in town that are with these 2 plans. So let's talk about these different plans. Okay, notice that there's 3 different plans you see here: silver, gold, and platinum. All right, but like we talked about a couple of slides ago, there's 2 silver HMO plans, 2 gold HMO plans, 2 platinum. They are exactly the same benefits. It's the difference is the provider network. Okay, so select silver, priority select silver. Select means Sharp, select, priority select means Scripps. So let's talk about benefits real quick. I'm not going to do this for every plan, but I do want to kind of really give you a rundown of these benefits and what they mean. So we'll start at the top. Deductible. A deductible is, generally speaking, what the insurance company says, you must pay all of this number before we start paying anything. All right. Now, there are some big exceptions to that. Notice that wherever you see the term DED waived, so for office visits, $60 for a regular doctor visit, $110 for a specialist, deductible waived. Diagnostic lab and x-ray, if you're getting this done in an office, $20 deductible waived. A freestanding facility, 0% deductible waived. So they're waiving the deductible. Notice where you see DED waived, that's really good. All the way down here at urgent care. Where you see deductible waived, that means you get that benefit on day one, $1. You do not need to spend all $2,500 first, okay? Family deductible, so if you have more than one person enrolled, you'd have a family deductible of $5,000 versus just $2,500. This term embedded means that really what it is two $2,500 deductibles. So if it's me and my wife and 3 children, if I have a major expense, I've met my deductible in full at $2,500 and my family has the other $2,500. Embedded just means that no one person has to pay the whole family deductible, okay? Out-of-pocket maximum, this is an important number. This number is the maximum that you would pay in any calendar year, no matter what happened. So as an individual, my maximum is $9,100. That includes this $2,500 deductible. As a family, it's $18,200. That includes the $5,000 deductible, so it's not another $5,000. And again, embedded. So no one person pays any more than their individual maximum out of pocket. All right. Office visits. You'll see 2 different numbers here. It's always regular doctor, primary care doctor, specialist. So you see 35 versus 70, 25 versus 50. With our silver plan, we waive the deductible. You'll also notice when we get into diagnostic lab, this is blood work, x-rays, complex imaging like CAT scans, PET scans, MRIs, you are going to, there's a differentiation between hospital-based providers for this and office or freestanding providers. So when you're looking at these different benefits, the insurance companies basically charge you more if you're getting x-rays, lab, and MRIs in a hospital setting. And this is simply because hospitals charge more for the same exact process or procedure that freestanding offices do, or doctors' offices, whatever it may be. So what I want you to know about this is, if you can be a little bit of a consumer, if you know you need lab work, x-rays, CAT scan, PET scan, MRIs, I strongly recommend you call your member services number on the back of your ID card and you say, I need an x-ray, I need an MRI, and I want to do it at the most cost-effective way possible. How can you help me find a freestanding facility or some facility where I get this benefit deductible waived? All right. It's a little bit more work, but when you look at this silver plan, if you need an MRI, if you do the work, it's $200 for an MRI deductible waived. If you don't do the work and if you don't become a consumer the same way we consume TVs and cars and clothes, we shop, right? If you don't do that and they send you to a outpatient hospital setting, you're going to pay the full value of that MRI up to $2,500. And then once you've met your $2,500, and if you need an MRI, you're going to pay $350 for that. So this is where it pays to be a smart consumer. Right below that, we have a $60 copay deductible waived for physical therapy, occupational therapy, speech therapy. Chiropractic is embedded in these medical plans here. There's an additional chiropractic benefit available through Choice Builder in the portal. You don't necessarily need to buy that. $15 deductible waived, 30 visits a year, same benefit for all the plans. Prescription drugs, there is, for the silver plan, a brand name drug deductible. So if you are an individual enrolled by yourself, you'll pay 100% of the cost for the first $200 for brand name drugs. So this is meaning in tier 2, 3, or 4. 4 is not pictured. It's self-injectable drugs, these new hepatitis C drugs, these newer cancer drugs. That's tier 4. So you'll pay more for that. Generic drugs or your tier 1 drugs are going to be before there's no deductible for that, so you'll just pay 15 or 20. Anthem has 2 different levels of pharmacies, so they have kind of a preferred network and not as preferred network of pharmacies. We're going to touch on that in a slide here in a moment, but these are the copays you'll pay for that. And then you get down here into the hospital facilities. So inpatient hospital, outpatient surgery, emergency room. Notice it all says 45%. This means that you would pay, after your $2,500 deductible, you would pay 45% of the cost, not to exceed $9,100. Okay, so again, the maximum is $9,100. So if I'm in the hospital, if I get in a car wreck and it's $100,000 in claims, this 45% does not mean that I'm on the hook for $45,000. What it does mean is if I have any of my deductible remaining, so let's say I paid nothing towards my deductible, I would pay 100% of the cost for the first $2,500. That would leave us with $97,500 remaining. I pay 45% of that $97,000. Blue Cross pays 55% until my total aggregate out-of-pocket expense reaches $9,100. Once I hit that number, I pay zero for the rest of the calendar year, and Blue Cross pays 100%. The reason why I said aggregate out-of-pocket expense is because a $60 doctor visit and a $15 chiropractic visit and a $15 generic drug, all of that, all of those $90 is going towards this $9,100. So if I did that, I would just have $9,010 left out of pocket. So every dollar you're spending here is going towards this $9,100. And once you hit there, either with one big major event or with the accumulation of small events, once you hit that number, you no longer pay for doctor visits, prescription drugs, hospital stays, emergency room visits, surgeries, x-rays, labs, MRIs, none of it. Okay, so this out-of-pocket max is important because that really is the maximum. Urgent care here at the bottom at $60. Now notice, again, I'm not going to do this for everything, but notice how different the gold and the platinum plans are. No deductible. Out-of-pocket max is much lower. Platinum is very low. Copays are lower. Deductibles for brand name drugs go away. The copays for those drugs get lower. But the most important part is check out how hospital, surgery, and emergency room is covered. It's no longer a percentage. Now instead, you're paying a flat copay of $750 a day for a hospital stay. And 4 days max means that if you're there day 5, 6, 7, 8, 9, you're no longer paying that $750 a day. Surgeries are $550 copay. Emergency room visit is $325. And when you look at the platinum plan, of course, hospital stay, surgery, emergency room, all the numbers are better, but the most important number is this out-of-pocket maximum. $2,300, the most you would spend in a calendar year, which is about as good as a health plan gets in California. You don't see a lot of plans where the maximum out of pocket is $2,300. So that's fantastic. Now, as far as choosing these plans and what's best for you, what you want to do is think about what kind of expenses can you predict. Do you have a hospital stay coming up? Do you need surgery? Are you planning on having a baby? Do you have regular MRIs scheduled? If you have regular visits, if you have regular things happening to you in your life, if you have predictable upcoming medical expenses, then you're going to want to lean towards one of the gold or platinum plans. So if you know you got some things coming up, the gold plan costs more than the silver plan, no doubt about it. But if you know you got a kid that is playing sports and ends up in the emergency room a lot, or you are having a baby, or you need surgery, this gold plan will cost you a lot less when you factor in the premium cost and the benefit cost. So these gold plans and platinum plans are really great for those of you that have predictable medical expenses coming up. For those of you that just need your health plan for a couple of doctor visits, a couple of prescription drugs, and maybe an urgent care visit, the silver plans are fantastic. They're a great value, and they're all you're going to need. So let's talk about our PPO plans. We got our bronze and silver plans here. We won't go through all those details again, but notice the bronze plan. This is going to be your lowest cost PPO plan, but a very large deductible of $7,300. Out-of-pocket max is $8,650. There's copays for doctor visits, which is great. A copay for blood work if you need it, and x-rays. Deductible for pharmacy is much higher. But really, this PPO bronze plan, if you had a hospital stay, if you had an emergency room visit, needed a surgery, you're going to be paying most of that $7,300 up front. So this will feel a lot like a catastrophic plan. So just be aware of that. Our silver plan, lower deductible, still got the out-of-pockets kind of high, but you got more copays across the board for everything. So silver PPO, really good for those of you that want a good value out of a PPO plan, want a lot of choice, but don't want to pay a ton of money. Gold and platinum, these we're getting into some rock star type plans, low or no deductibles, copays across the board, tons of choice, lots of options here. So these are the PPO plans that are available as well. We talked about that prescription drug benefit, having level 1 and level 2 pharmacies. So these are the pharmacies you want to be kind of paying attention to. CVS, Target, Walmart, Costco. If you're going to these pharmacies, you're going to pay the lower copay amount. So we'll flip back to that real quick. So remember, we have, level 1 for generic is $10, level 2 is $20. So at Costco, it's $10, but at Rite Aid or Walgreens, it's $20. Okay. Same thing with all these other ones. So again, they're asking you to be a little bit of a consumer. So you're going to want to just make sure you're going to the level 1 pharmacies. Level 2, it's still covered, but level 1 is cheaper. And in order to find these tiered networks, you could go to anthem.com/CA. You'll order and manage prescriptions, find a pharmacy. You can also reach out to us. We can help you. You can reach out to member services, and they can help you find and identify the level 1 drugs. This video is going to be embedded into the enrollment portal, which is open and available to you every day and every minute of the year. You can open this presentation and kind of go back to this point and see this information as well. So since we're moving to a new provider, there's going to be some need to find providers. So how you do that is you go to anthem.com/CA. You'll see there at the home page, there's a little find care button at the top. You'll go select your plan or network. You'll go medical plan, California. Even if you don't live in California, this is where the plan network is offered. So the company is in California. You're going with medical employer sponsored. And then for those of you looking for the priority select HMO, you choose priority select. For the select HMO, select, and then prudent buyer PPO is your PPO network. Once you get to that, you select that page, you can enter your zip code, you can enter the name of a doctor. It'll as you enter in Smith, it'll start filtering out and showing you the doctor's names. You can search for different types of providers. And then things like finding an urgent care facility is really important. I recommend everybody identify the nearest urgent care facility to you so that you can go there instead of potentially an emergency room visit, which will cost you a lot more. Here's a little plug for the Sydney app. This is their smartphone app. It's called Sydney. You want to make sure you download this app from Anthem Blue Cross. Lots and lots of really great stuff that's available to you. You can find doctors. You can see your health dashboard, chat, virtual care, health records. Lots of really good stuff in that app. And if you're looking for one singular thing you can do to improve your healthcare experience is have this app on your phone. Claims, benefits, ID cards, talking to doctors, scheduling visits, ordering prescription drugs, all these things happen right there. And so it really, really, really can improve your experience. Some more added value stuff that you can use with the Sydney app and with Anthem Blue Cross is they've got 24/7 live health online doctors. Teledoc is another way you can talk about this. So there's some rules on how you get started here for that. More information on live health online, video visits with doctors, really, really cool stuff here. Anthem is on the forefront of using technology. They can really help you streamline your benefits. And don't wait for when you need this to start this process. As you can see, there's a number of steps that happen here. Once you take all those steps, you really, really are on the forefront of using your phone, using technology to make your experience better. Lots of discounts with Anthem. So for those of you that are enrolling just in the medical plan, don't want to pay for the dental or vision plan for whatever reason, lots of vision, hearing, and dental discounts. Custom aligners instead of the braces down here at the bottom. Premier LASIK, you can save $800 on in the LASIK network provider. So lots of good discounts there. Some more stuff on fitness and health, family and home stuff. So 23andMe. If pet insurance is something you're interested in, you can get a discount of 5 to 15% on that, and also other medicine and treatment type resources. So lots of good stuff with Anthem Blue Cross. So let's talk about dental. We've got our HMO dental plan. So Delta Dental is who we've been using. Nothing's changing with that. We've got our 3 HMO plans. HMO is really great for those of you that just want a couple of free cleanings. The benefit of an HMO plan is there's no annual maximum benefit, and the cost, the premium coming out of your paycheck is really competitive. The drawback is there's not nearly as many providers. Okay, so if you want a lot more providers, you're going to want to look at these PPO plans, silver, gold, and platinum. The benefit of a PPO plan is lots of choice, a better experience when you go to the dentist. You can get in faster, and the reason is with PPO plans, those dentists don't make any money until you show up, whereas with HMO dental plans, they get paid a monthly payment for you to be a part of their network, and they don't make a lot from the copays that they charge. So PPO dental plans, your experience is improved. You can get in there a lot quicker. A drawback of PPO plan, there's 2. There's a calendar year maximum. So you see there at the bottom, calendar year max on the silver plan's 1,000, gold is 1,500, platinum is 2,000. This maximum means that once Delta has paid out of their pockets that much money, they are no longer going to pay any more towards your benefits. So you can run out of benefits. The other drawback is they're more expensive. So it costs more money out of your paycheck every month for this. But the reason why people buy dental PPO plans is for the choice, lots of different options. One interesting thing to note is if you have not signed up for a dental plan, and maybe you're thinking about a dental plan, these maximum benefits, so we'll look at this gold plan, $1,500 maximum. This is a calendar year maximum, meaning you have from July 1st to December 31st to spend $1,500 of their money. And then on January 1st, you get a new $1,500. So you could sign up for this, pay 12 months of premium, but given how we are straddling the calendar year, our effective date's July 1st, 6 months in one year, 6 months in the next, you could get 2 years worth of maximum benefits for the price of 12 months of premium. So kind of a nice way to stick it to the man a little bit here and get more value out of your PPO plan. Just to note, the Premier Network is the network that the Platinum PPO uses, one of the largest PPO networks in the country. So higher maximum benefit and more providers available. So Vision, we have our 2 Vision plans from VSP. There's a gold and a platinum. These plans are both identical in every single way except for one important one. The gold plan and the platinum plan both give you a $10 copay for eye exams once every 12 months. This is what these numbers mean down here. So this first 12 is how frequently they get a $10 copay. The second 12 here, you see, is how frequently you get this $25 copay for lenses. Exactly the same for both, once every 12 months. The last number, 24 here with gold and 12 with platinum, this is how frequently you get your $180 allowance for frames or your $150 allowance for contact lenses. With the gold plan, you get this benefit every 2 years. With the platinum plan, you get it every year. All right. This is why I say the platinum plan is the only good choice here. There ain't nothing wrong with the gold plan. It's the exact same number of providers, the exact same cost for an eye exam, exact same cost for lenses, the same allowance for frames. The difference is platinum gives you the frames allowance or the contact lens allowance once every year versus once every 2 years. All right. The platinum plan costs about $23 more per year than the gold. So it's a little less than $2 more per month, and you get $180 of benefits tax-free. All right, so the platinum plan is a better value. If you're using these benefits, buy the platinum plan, pay $23 more of tax-free premium in order to get $180 of tax-free benefit. No brainer. So let's talk about a couple of some new benefits. We're going to go through a lot of stuff here, all through the Hartford. So we've got a new benefit, a new employer-paid life insurance benefit. So your employer is paying for each of you to have $25,000 of life insurance. That goes into effect on July 1st. This is free when you're enrolling into it. It'll be something that's mandatory for you to enroll in. Additionally, there's a voluntary life insurance. So you can elect up to $350,000 of additional voluntary term life. You can elect $100,000 guaranteed issue no matter your health status. If you decide to do more than 100,000, somewhere between 100 and 350, you'll be asked to fill out a evidence of insurability or a health questionnaire, and they can either approve it or decline it. All right, but no matter what, you can do 100,000 guaranteed issue. The voluntary life, this additional amount is paid for 100% by you, the employee. And you also can enroll spouses up to $25,000 guaranteed issue, and children $10,000 per child guaranteed issue. With spouses, you can elect more than 25,000. Anything over 25,000 would require a health questionnaire, and you can elect no more than 100% for your spouse than what you elected for yourself as the employee. So you couldn't do 20,000 for yourself as the employee and 50,000 for your spouse. You can elect no more than 100% of your employee election for them. Again, these are two different things. The employer paid life insurance is happening no matter what. And then separately, there's the voluntary life insurance where you can elect to have 0, 10,000, 20,000, 100,000. All of that would be guaranteed issue. And then you can do more than 100,000, but then the employer is going to ask, Hartford will ask for you to fill out health questionnaires. More information on that in the portal. We also have a critical illness insurance policy. So this is a policy that kind of layers on top of your medical plan. It provides financial protection in case of a serious illness or a medical condition. Pays out a lump sum when certain diagnoses happen. It's a really good policy for those of you that want to insure yourself against something that might be hereditary in your family, something that you might be concerned about. Again, this pays in addition to anything that you have with your medical plan. This is a look at the benefit summary. So if you were to have, there's two different choices. There's a $5,000 benefit and a $10,000 benefit. You can choose yourself which one you want. And this 100% means this is how much you get if you were to have that. So if I chose the $10,000 critical illness benefit and I had a heart attack, a STEMI, I'm not sure I know what that means exactly, but I'd get 100% of that 10,000. If it was an NSTEMI, I'd get 2,500 of that 10,000. A severe stroke, I'd get 100% of the benefit I elected. Okay, so you'll see how this is. You can see a lot more information in the enrollment portal on this, but this is a really great way to kind of layer on top of your medical plan and cover yourself for any of these critical illnesses that unfortunately befall many of us in our lifetime. We have accident insurance. So accident is great. Again, layers on top of your medical plan. You don't even have to have a medical plan in order to have this accident insurance plan. If maybe you have, you're an extreme sports enthusiast, maybe you have a child or a spouse that is doing a lot of sports or ended up in the emergency room or trip, fall, go, fall down, go boom type stuff. This pays out a lump sum for injured person upon some of these covered accidents. Complements your health insurance. So lots of different accident payouts. Here's just a couple of examples of what you might need if you have an accident in an ambulance. $750. You end up in the emergency room because of that accident, that's another $200. You get a concussion, that's $200. If you get a 6-inch or greater laceration, that's $1,000. Broken ankle, $2,000. So there's a huge list of these accident payouts and more information in the enrollment portal. But a great plan to layer on top of what you already have. We've got a hospital indemnity, aka a hospital confinement benefit that you can enroll in. Again, all of these benefits are separate and you can choose to enroll on them separately and pay for it yourself with pre-tax dollars. So if you wanted the hospital indemnity plan for yourself, you could get this plan, and on a first day of a hospital confinement, you get $1,000. And for another 90 days beyond that, you get another $200 per day for hospital confinement. If you're in the ICU, that's $400 a day, up to 30 days per year. This is a really great way for some of you to buy that silver HMO plan, save the premium dollar, and maybe buy this hospital indemnity plan so that if you did end up in the hospital and you had to pay that deductible of $2,500, you get $1,000 on one day of a hospital stay. For those of you that might be having a baby and knowing you're going to the hospital, this hospital indemnity plan would be a fantastic idea because it's going to pay you, and it's some of these out-of-pocket expenses you have through your medical plan. This is going to pay for those. Okay, it'll pay you, and then you pay Bantam Blue Cross, or you pay your provider. So another really, really great plan for you. In addition to those, we got a whole bunch of added value plans we want to make you aware of. There's the Employee Assistance Program, which is super, super popular right now. There's two different versions of it. There's the Ability Assist and the Beneficiary Assist. So the Ability Assist is, personal, emotional, work-life balance, financial information and resources, legal support, health and benefit services. The EAP program is something that is truly outside of your employer. This is a really great place to start for any of the mental health issues that all of us go through on a day-to-day basis. Really great way to do this. This is free. All of you get this with that life insurance policy that is also free. These things aren't free, of course. Your employer is paying for them, but to you, it is a free benefit. And it's a fantastic place to start on your mental health journey if you don't know where else to start. These EAP programs come with face-to-face visits, so you can actually go sit down with someone, up to 5 of them, depending on the issue. So lots of really great services there. In addition, we've got a travel assistance and ID theft protection program. Again, this is part of what your employer is paying for, and it is free to you. So for those of you that want some of these services, that want help, multilingual assistance for if you're traveling for business or pleasure, there's lots of really great resources here. Maybe you find yourself in another country and you don't speak that language, but you're having a medical emergency. You call these guys and they help translate and they help communicate with the hospital or the doctors so that you can get the care you need efficiently, effectively, and without any further risk to your health. A little bit more on the travel assistance and ID theft program. So here's some of the identity theft information, some of the other things that are part of the travel assist. So you can detection services of identity theft, fraud alert to 3 credit bureaus. So lots of really cool stuff that's available to you, paid for by your employer. State guidance. So a lot of times we end up needing we don't have a will and we need some help with drawing up a will. You get online assistance from licensed attorneys, unlimited revisions at no charge, additional estate planning services for purchase. So really, really cool stuff there. When the time comes when we lose somebody important to us, there is a funeral concierge service. So it's very, very difficult. Lots of different things happening in our life when we lose a loved one. This particular program, again, no cost to you, the employee, round-the-clock access to expert advisors, personal support from licensed funeral directors, pre-planning tools, a lot of different really cool things that the Hartford provides for you. Again, and here's how you enroll in that. This information is embedded into the enrollment portal. Speaking of the enrollment portal, it is at withindesign.ease.com. All of you will get a link inviting you to log in and enroll. For those of you watching this video after we do the June 8th presentation, you should have already gotten this information. If you don't have this information, you can reach out to Sean or myself and we'll send it out to you. The system is actually pretty easy to navigate. Many of you have already been through it. If you have any issues with the password, there's a little forgot button right there. This works on your mobile device as well. So most of you should have no issue navigating this. If you do, we're happy to help. So what's next? So you're going to check your email for your EASE invitation and login. We'd like everybody to do this by Friday, June 16th. If you have any questions, if you need any answers, we are here for you now and in the future. Here's our information. This is the last slide of the presentation. And it's important to know that we are proud and honored to be this professional for you, and we are here to serve you every day of the year. Thank you so much for your time. I appreciate it and look forward to talking to you.